ब्रेकपछि फेरि स्वागत छ गुड मर्निङ नेपालमा। ब्रेकमा जानु अघि मैले अलिकति चर्चा गरिसकेँ। नेपालको स्वास्थ्य क्षेत्रमा अझ हामीले स्पेसिफिकली भन्दाखेरि अर्गन डोनेसनलाई लिएर नेपालको अवस्था के छ, चुनौती के कस्ता रहेको छ र सँगसँगै विश्वव्यापी तरिकाले नै हेर्ने हो भने यसको स्टेटस के रहेको छ भनेर बुझ्नको लागि बुझाउनको लागि आज हामीसँग दुई एकदम विशेष अतिथि जोडिरहनु भएको छ जसले आफ्नो एक्सपिरियन्स र नेपालमा गरिरहेको कार्यको बारेमा आज हाइलाइट गर्नुहुन्छ। केही समय अघि मात्रै पनि हामीले नेसनल वर्कसप अन ब्रेन डेथ डिक्लेरेसन डोनर म्यानेजमेन्ट एन्ड अर्गन डोनेसन प्रोसेस पनि भएको थियो। त्यसमा विश्वव्यापी अस्पतालहरूलाई डक्टर्सहरूलाई राखेर धेरै कुरामा यसको बारेमा छलफल पनि भएको थियो जसको बारेमा हामी आज एकदमै विस्तृत छलफल गर्छौँ। कार्यक्रममा स्वागत गरौँ हाम्रो पहिलो अतिथि डाक्टर प्रदेश सापकोटाज्यूलाई र सँगसँगै आज हामीलाई ग्लोबल पर्सपेक्टिभको बारेमा इन्साइट्स दिनको लागि कार्यक्रममा स्वागत गरौँ डाक्टर सिनेमन सुल्लिवनलाई। गुड मर्निङ नेपालमा। आई वुड लाइक टु वेलकम बोथ अफ यू.
Thank you.
It's a morning show, so definitely you are doctors, so you don't particularly you have a morning routine as well. So I'd like to start with the conversation that is now also has started in Nepal about organ donation. Dr. Pradez, I would like to ask you this question. In Nepal, when we talk about organ donation, a layman, how can a person जसले चाहिँ organ donationलाई चाहिँ एकदमै सजिलोसँग बुझ्नु पर्यो भने कसरी बुझ्ने के हो भनेर बुझ्ने जसले बुझेकै छैन organ donation भने के हो?
Thank you. Basically नेपालमा अझै पनि organ donation, how we call it, अंगदान भन्छौँ हामी र बेसिकली मान्छेहरुमा अझै पनि कन्सेप्ट चाहिँ आइसकेको छैन। मरेपछि अंगदान गर्नु मिल्छ, जिउँदै हुँदा अंगदान गर्नु मिल्छ, अंगदान गरेर अरूको लाइफ सेभ गर्न सकिन्छ भन्ने यो कन्सेप्टहरु चाहिँ अझै पब्लिकमा चाहिँ राम्रोसँग आइपुगिसकेको छैन। तर स्टिल अब वी बीन ट्राइङ हैन यो कुराहरुलाई हेल्थ केयर वर्कर्सहरु देन आफ्टर स्लोली इट्स गोइङ अन पब्लिक र मरेपछि हामीले अंगदान गरेर मान्छेहरुको कयौं लाइफहरु वी क्यान सेभ भन्ने कुराहरु चाहिँ बिस्तारै डिसइन्टिग्रेट हुँदैछ पब्लिकमा पनि।
Yes. So recently there was a workshop as well which I just mentioned about it. What was the purpose of this workshop and how was your experience doing this workshop, Dr. Cinnamon?
Thank you. The workshop was wonderful. The workshop was designed to educate different healthcare workers around Nepal. We had 27 different hospitals from around the country come and participate. And what we wanted to do was make sure that practitioners in Nepal were declaring brain death that was consistent with brain death declaration around the world, that the tests were being done properly, and also that people were given the opportunity to practice on a simulator and practice with a family to have that discussion, which can sometimes be very difficult.
Yes.
So the more you can practice it, the more you can have those discussions and have that information, the more successful you're going to be with having people agree to donate.
As you just mentioned about brain death, it's very easy for healthcare workers to people working in the health sector to understand about what brain death is about. But how does a normal person understand the meaning of brain death? How you explain it in a very easy way?
I think that's a great question. The best way that I describe it to patients' families is that we can keep the body alive, we can keep the heart beating, we can keep the lungs going. Medicine has advanced very far. But when we say that a person is brain dead, it means that there's no blood flow, that there are no things going on in the brain, that the function of the brain is completely gone. Not just the areas for thought, but the areas in the brain stem that determine how much you breathe, how fast your heart goes. All of that has gone away. So your person is no longer there. So it's a classification of death that is legally known and legally recognized around the world.
Yes, and when we talk about Dr. Pradez, it's मैले हजुरलाई सोध्न चाहे नेपालमा ब्रेन डेथलाई लिएर अर्गन डोनेसन लिएर कस्तो खाले कन्भर्सेसन चाहिँ तपाईले चाहिँ घर-घरमा सुरु भइसकेको अवस्था देख्नु भएको छ?
सो बेसिकली नेपालमा चाहिँ मानव अङ्ग प्रत्यारोपण ऐन 2055 मा आयो। त्यसपछि फेरि पहिलो संशोधन 2072 ले चाहिँ मस्तिष्क मृत्यु ब्रेन डेथलाई लिगली रेकग्नाइज गरेको छ। देन आफ्टर त्यो लिगली रेकग्नाइज भइसकेपछि अझै पनि मान्छेहरूलाई ब्रेन डेथ र रियल डेथ सिनारियो जुन हुन्छ त्यसलाई अझै पनि नेपालमा बुझाउनु चाहिँ आवश्यक छ।
ब्रेन डेथलाई त कोमा पनि भनेर बुझिन्छ नि।
कतिले त्यसरी बुझ्छ तर एक्ज्याक्टली यो होइन कोमा। ब्रेन डेथ इज नट कोमा, इट्स डिफरेन्ट हैन। तर ब्रेन डेथ इज इरिभर्सिबल लस अफ ब्रेन फङ्सन हैन, इरिभर्स, इट्स डन, वी आर डेड। तर हामीले अझै पनि हस्पिटलहरूमा र कति पब्लिकलाई चाहिँ बुझाउन अझै बाँकी छ। ब्रेन डेथ इज डेथ, त्यो चाहिँ लिगल्ली पनि हो र सबै क्लिनिकली पनि हो। इट्स डेथ हैन, मस्तिष्कको मृत्यु भएपछि इट्स डेथ। बट फर अ सर्टेन टाइम हामीले चाहिँ अरू औषधिहरू दिएर with the help of medicine, something, we can regulate heartbeat, pulses, pressure for a time being. And we have that clinical window where we can take out the organs and transplant.
So, ब्रेन डेथको समयमा तपाईले भनिराख्दाखेरि जुन प्रक्रिया अर्गन डोनेसनको चाहिँ सबसे गर्ने उच्च समय भनेको ब्रेन डेथ भएको समयमा नै हो। यसमा गरिएको अर्गन डोनेसनलाई चाहिँ एकदमै राम्रो भनेर पनि मान्न सकिन्छ।
हजुर, त्यो बेलासम्म चाहिँ तपाईको अर्गन, सोलिड अर्गन, फर एक्जाम्पल किडनी, लिभर, हार्ट, लङ्स, इन्टेस्टाइन्स अनि यो पेन्क्रियास, दे आर स्टिल फङ्सनिङ, सो द्याट अब फङ्सनै नभएको कुरालाई वी क्यान नट ट्रान्सप्लान्ट इन अदर बडी। So while they are functioning, we can take out, preserve in a preservative, and transplant in another body who are waiting for organ transplant.
And as you said, it's really legal. यो भइ पनि रहेको छ, यो यसको बारेमा धेरै यो कस्तो हुन्छ, यो ब्रेन डेथको लिगलिटी फर्म कस्तो हुन्छ, हरेक मान्छे जो अपरेट हुन जाँदैछ उसले के फर्म भर्नुपर्ने हुन्छ कि यसको प्रक्रिया चाहिँ कस्तो हुन्छ, कसरी मैले डोनेट गर्ने, कसरी गर्ने भन्ने प्रश्न पनि हुन्छ। यो के हरेक अपरेसनको अगाडि हुन्छ यो प्रश्न हुन्छ?
हजुर, एक्ज्याक्टली। अब फर्स्ट यु शुड बी अ डोनर हैन। अब नर्मल्ली हामी जिउँदै हुँदा पनि वी क्यान प्लेस आई वान्ट टु बी अ अर्गन डोनर आफ्टर डेथ हैन, त्यो एउटा गर्न सकिन्छ। र रियल सिनारियो हस्पिटलमा आइसियुमा कोही ब्रेन डेथ भइरहेको छ, क्लिनिकली इट्स प्रुभन हैन, आफ्टर चेकिङ टेस्टिङ डक्टरहरूले आइसियुमा चेक गर्नुहुन्छ अनि उहाँहरूले ल दिस पेसेन्ट इज ब्रेन डेथ भनेर डिक्लेयर गरेपछि चाहिँ we can talk with the family, relatives, whether they would like to donate organs and save a lot of lives. And त्यो चाहिँ एक्चुअल प्रोसेस।
अनि यस्तोमा फ्यामिलीको रिएक्सन्स कस्तो हुन्छ, तपाईले कसरी ह्यान्डल गर्नुहुन्छ? फ्यामिलीहरु कति पोजिटिभ हुनुहुन्छ या फ्यामिलीले हैन यो त पोसिबल छैन भन्नुहुन्छ?
सो नेपालको सिनारियोमा what I have seen, my experience, जुन फ्यामिलीलाई चाहिँ पहिला अर्गन डोनेसनको बारेमा थोरै भए पनि कुरा थाहा छ, they easily accept हैन। तर अर्गन डोनेसनको जुन कुरा थाहा छैन उहाँहरूलाई, कहिले सुन्नुभएकै छैन, then it's very hard for them to explain those things त्यो सर्कमस्टान्सेसमा।
So, Dr. Cinnamon, I would like to ask, how has your experiences being educating people on organ donation's importance? Is it always very easy for them to make them understand globally, with your global experiences as well? How has your experience working on the field of organ donation?
In terms of families or in terms of...
especially families,
sure.
The reactions of the families.
Sure. So I'm an ICU doctor in the United States.
Yes.
And what I find is that it depends on if the family has had education about organ donation before they come to the hospital.
Yes.
So if a family has had somebody else donate, or if they were educated in school, then they are very likely to donate. What we find is that if a family comes in and they have no idea about it, and they don't understand brain death, we can start talking to them early, and that's typically what we do. Yes. Our number one goal is to take care of that family.
Yes.
And what we do in the United States is we separate out the people taking care of the patient, wanting to make them better and healthy,
yes,
and get them back to their family, and the people that talk about organ donation. So when we have a patient that might be a possible organ donor, we contact our transplant coordinator, or we contact our organ procurement organization, and we say, we have a patient that we're trying to get better, but they might not. Why don't you go ahead and start talking with the family about the possibility? And so we have multiple conversations. And if we are allowed to have multiple conversations and explain to the family, I'd say that many do want to donate, because they want to take something that's a tragedy for them and at least have something good come out of it.
Exactly.
If they can have their family member help up to 75 other people, then at least when that patient dies, they have a gift that they can give others. And so if families decide not to donate, that's fine. We respect that.
Yes, so when you mention about the families, in the United States itself, how is the perspective for organ donation? How well accepted it's there?
It's extremely well accepted.
Yes.
So brain death organ donation is the number one way that we have organs for our recipients. Brain death organ donation, we started working on educating the public. We have on our license, our driver's license, you can say that you are an organ donor, so that if someone's not around from your family when you are in a motor vehicle accident, when you go to the hospital, they can look on your driver's license and see that you want to donate. So we've had education systems in place for many decades now. It wasn't always that way. It's something that has to grow. But we have multiple people that discuss it. We have things in our hospitals that talk about organ donation. We have posters. We have things so that the people coming in at least have an idea from the beginning.
So when you mention about it's very well accepted,
yes,
what are the things that really makes people feel that organ donation is really well? So it's the policies, it's the education. What are the things that the United States is doing really well that other countries can learn from?
That's a good question. I think one of the things we do well in the United States is we start educating. We talk about organ donation and education for that in our medical schools.
Yes.
We talk about it in our residencies. So we have learned about it all the way from the beginning. So we have education for our healthcare workers.
Yes.
We also have education for the public. There are social media campaigns. There are ads that go out on television. We also highlight stories. We highlight stories of people that have donated. Many times on the news, you will see wonderful stories of, say, a donor family that gets to meet somebody that got a heart or a liver. We allow that if both families agree. We also celebrate people that donate. Every person that donates is given, their family is given a letter showing this went, you were able to save the life of these many people. Thank you so much. And we have national days where we talk about organ donation.
So it starts from every route. It starts from health to work, from policies to educating families,
yes,
to how we are prioritizing organ donations as well. And when we talk about that, Dr. Pradez, नेपालमा पनि यसको ऐन छ. नेपालमा पनि organ donation गर्नको लागि राम्रो ऐन रहेछ. तर यसको इम्प्लिमेन्टेसन अझै अलि कमजोरै देखिन्छ. यसको कारण के हुन सक्छ? मान्छेहरूले एजुकेट गर्ने, अवेयर गर्ने त एउटा पाटो हुन सक्छ भने यो इम्प्लिमेन्ट गर्नलाई सरकारको दायित्व कस्तो हुनुपर्ने हो जस्तो लाग्छ. किन यसको इम्प्लिमेन्टेसन चाहिँ एकदम कमजोर छ जस्तो लाग्छ तपाईलाई?
ओके, हजुरले एकदम राम्रो प्रश्न गर्नुभयो. सो लास्ट 1 डिकेड 10 वर्षमा नेपालमा जम्मा 7वटा मस्तिष्क मृत्यु भएपछि अङ्गदान भएको छ. ओन्ली 7, हैन? इट्स अ भेरी स्याड स्टोरी, बट स्टिल अब सुरुवात भयो भनौँ. तर हाम्रो नेतृत्व जुन चाहिँ हाम्रो लिडरसिप हु वर्क्स अन्डर द मिनिस्ट्री अफ हेल्थ, त्यहाँ एउटा समन्वय इकाइ, अङ्ग प्रत्यारोपण समन्वय इकाइ भन्ने छ. आई थिङ्क दे सुड बी भेरी प्रोएक्टिभ doing all these things. They are the number one government bodies. For last 10 years, very few things are being done. समस्या आई थिङ्क त्यहाँ छ. म अहिले नेपाल सरकारको स्वास्थ्य मन्त्रालयमा गएर अङ्ग प्रत्यारोपण सम्बन्धी बुझ्न खोजे भने nobody can explain. They will point a direction to Human Organ Transplant Center, Bhaktapur. हाम्रो विडम्बना त्यहाँ छ. र अरू कुराहरू हाम्रो लिगल सिस्टममा पनि फ्लजहरू छन् जुन कुरा मैले उठाउँदै आइरहेको छु. त्यो समन्वय इकाइले हाम्रो हस्पिटलहरूसँग समन्वय गरेर काम गर्न एकदमै जरुरी छ. नाउ द सोल राइट एभ्रिथिङ इज गिभन टु ह्युमन अर्गन ट्रान्सप्लान्ट सेन्टर. अनि उहाँहरू आफैमा धेरै काम छ. त्यहाँ धेरै किडनी ट्रान्सप्लान्टहरू हुन्छ त्यही भएर यसलाई डिसेन्ट्रलाइज गर्ने काठमाडौँ भ्यालीको मेजर हस्पिटलहरू आउट अफ भ्याली मेजर हस्पिटलहरूलाई कोअर्डिनेट गरेर राम्रोसँग ट्रेन गरेर त्यहाँको डक्टर नर्स ट्रान्सप्लान्ट कोअर्डिनेटरहरूलाई रेगुलर ट्रेनिङ दिन एकदमै जरुरी छ धेरैभन्दा धेरै हस्पिटलको हाम्रो बेसिक हेल्थ केयर वर्करलाई नै यो कुराको राम्रोसँग ज्ञान छैन त्यही भएर पनि हामीले यो फर्स्ट टाइम नेपालमा ब्रेन डेथ वर्कसप गर्नु एकदम इम्पोर्टेन्ट भनेर फुलब्राइट कमिसनबाट डक्टर सुलिभान आउनुभयो एन्ड सी हेल्प अस डुइङ दिस वर्कसप फर अ विक होइन मेनी हस्पिटल वेयर पार्टिसिपेटेड त्यही भएर पनि बेसिक नम्बर 1 त्यो भयो नम्बर 2 फ्लजहरू अरू चाहिँ धेरै कुराहरू यो लिडरसिपकै कुरा आउँछ हाम्रो देशमा होइन अब वी हेभ अ न्यू थिङ्स कमिङ न्यू होपफुली थिङ्स विल चेन्ज एन्ड गो इन द राइट डिरेक्सन हामीले अब लबी पनि गर्दैछौँ कुन कुरामा भन्दाखेरि तपाईँलाई पनि थाहा छ हामी नेपालीहरू वी लाइक टु गिभ थिङ्स होइन फ्रम द अर्ली हाम्रो संस्कार त्यो हो हामीलाई दिन मन लाग्छ कोही नचिनेको मान्छे हाम्रो घरमा माग्न आयो भने पनि वी गिभ देम फुड अर मनी अर समथिङ वी लाइक टु डोनेट इट्स आवर कल्चर होइन सो धेरैभन्दा धेरै नेपालीहरू कतिसँग मैले यो अङ्गदानको कुरा गरेँ दे लाइक टु डोनेट देयर अर्गन्स द सिस्टम इज भेरी डिफिकल्ट एउटा धनगढीको मान्छेलाई म अङ्गदान गर्छु म अङ्गदाता बन्छु भनेर एउटा कार्ड बनाउनलाई ऊ काठमाडौँको भक्तपुरको अङ्गप्रत्यारोपण केन्द्र पुग्नुपर्छ इट्स भेरी डिफिकल्ट फर देम
यो तपाईँले भनिराख्दाखेरि मलाई पनि थाहा थिएन अर्गन डोनर बन्नको लागि चाहिँ अस्पतालमा गएर भन्ने जस्तो लागेको थियो तर यसको लागि अझ हामी भक्तपुरै जानुपर्छ
गएर तपाईँले फर्म भरेर यु हेभ टु सो योर नागरिकता होइन एउटा फोटो टाँसेर ल्याप्से लगाएर सही गर्नुपर्छ
फेरि पनि विकास कायमको कुरा गर्दा सबै काठमाडौँ नजिकै केन्द्रित हुन्छ त्यसले गर्दाखेरि पहुँचभन्दा बाहिर छ भन्ने कुरा तपाईँले हाइलाइट गरिदिन्छ
यसलाई एकदम एक्सेसिबल बनाउनु पर्यो जो मान्छे पोखरा छ धनगढी छ अदर सिटिज they can do from there.
Yeah, they don't need to come to the center.
They don't need to come to just to become an organ donor. होइन होइन भन्नुस् न हजुर
या एक्ज्याक्टली किनकि हामीलाई पनि त्यही हुन्छ कि पहुँच नजिक छ भने गर्ने मोटिभेसन आउँछ तर पहुँचै टाढा भइसकेपछि होस् भनेर हामी छोड्छौँ मानवको हामीले चाहिँ यो तपाईँले भनिराख्दाखेरि आफूलाई पनि धेरै प्रश्न आइरहेको छ कि म अर्गन डोनर पनि बन्न सक्ने इलिजिबिलिटी क्राइटेरियाहरू पनि यो सबै गरेर भक्तपुरमै थाहा हुन्छ हाम्रो के चेकिङ हुन्छ कसो हुन्छ यो चाहिँ
त्यो चाहिँ बन्न चाहिँ सबै नै पाइन्छ इट्स अन वेबसाइट क्राइटेरियाहरू यु सुड बी एटलिस्ट 18 इयर्स ओल्ड एन्ड नेपाली सिटिजन होइन त्योमा केही छैन किन भन्दाखेरि तपाईँको बडी जस्तो भए पनि वेदर यु वान्ट टु डोनेट योर होल बडी अर पार्ट्स अफ योर बडी होइन आफ्टर डेथ त्यो सबै कुरा त लेख्न मिल्छ तर यो प्रोसेसलाई एकदम इजी बनाइदिनु पर्यो होइन सो द्याट मोर एन्ड मोर पिपल विल come forward to donate.
Yes, that's very true. I think accessibility in health is one of the most important parts, especially in Nepal when we talk about where we lack at. We need to have a stance there to have better policy in implementation.
Exactly.
Dr. Cinnamon, while you're experiencing and you travel around the world, you come to Nepal and maybe definitely you have a perspective on South Asian countries as well. What can Asian countries, especially a country like Nepal, actually learn from successful countries which are doing really good in policies, which are doing really good with prioritizing doctors and healthcare workers as well? What we should be learning to have those kind of successful stories work here in Nepal also, or we need to have a very different module, or what is it?
I think that's a wonderful question. So there's actually a wonderful model out of Croatia. So Croatia is essentially where Nepal was 10 years ago. So they basically 10 years difference and where they're at now. So what they did is they are a very limited resource country, and yet they are one of the top deceased donor organ countries in the world.
Yes.
And the way they did it was they had an attack of, let's make sure that our policy is correct. Let's make sure that we support organ donation, and not a single person in that country has to pay for organ donation. So they have made it part of their financial policy to pay for organ donation. That was number one. Number two, they made sure that all of their healthcare workers involved were educated. So they had a big push towards education around organ donation. Number 3, they started making sure that their population was aware. They became what's called a soft opt-out country, meaning every person is considered an organ donor unless they say they don't want to.
But they have that access.
They have the access. And the reason it's called a soft opt-out is if you say that you want to be an organ donor, I'm sorry, if you say that you don't want to be an organ donor, that's fine. But if the family says they don't want to donate your organs, they can do that. But if no one says anything, it's automatically assumed that you will donate. So it's an opt-out rather than an opt-in country. The other thing that they did is they, again, started really celebrating organ donation. They have a National Organ Donation Day. They put together a media campaign to let people know about the gift of organ donation. The other big thing that they did that every country has to do is they have a national transplant coordinator within the Ministry of Health, and that person is responsible not only for helping coordinate, but they're also responsible for looking at the quality. They go to each transplant hospital and they look and see how they're doing, what they're doing. They make sure they're doing it correctly. And so they look at themselves and they're honest with how they're doing, and then they make changes to make sure that everything is going the way that it should. So they have put all of these policies in place. Here in Nepal, you already have people like Dr. Sapkota and the Nepal Organ Donation Foundation that is working so hard to help educate not only the population, but educate healthcare workers. So you have that piece in place. So the next thing needs to be legislation. Currently in Nepal, you have to be a Nepalese citizen to be able to declare someone brain dead. So you're lacking the ability to have international experts come in and help.
Yes, true. That becomes a very huge gap as well.
Right. So you have an issue where you have a lack of a workforce just because of a legislation. So even if that was changed to say that if you are recognized as a practicing physician and if Nepal recognizes the expertise from whatever country, now you'll have more people that will be able to come and help and work and help declare brain death and teach others.
So when you mentioned about that, exactly brings also highlights upon why it is very important for doctors to healthcare workers to be they need to be trained, they need the facilities as well, so that when we need an internal experts as well, that everything comes with policy, everything comes down to a policy and how we implement that, how we aware about that. Dr. Pradez, when we talk about experiences, you are trying to lobby with the policies to make a better framework, also with population as well. But in Nepal, as we mentioned the numbers, मान्छेहरुमा एकदम धेरै चीज से डर हुन्छ क्या, हामीलाई चाहिँ जे गर्न पनि डर चाहिँ लाग्छ policy किनकि त्यही व्यक्ति नै हाम्रो नेतृत्व गर्न नै जाने हो, त्यो सबै समाजले चाहिँ organ donation कुरामा चाहिँ डर लाग्ला, पाप लाग्ला भन्ने यो धेरै धारणा छ क्या हामीमा. यो चाहिँ किन हुन्छ होला जब organ donation को चाहिँ कुरा आउँछ? तपाईले अघि नै भन्नुभयो कि हामी दिन पनि मन लाग्छ, तर organ donation को कुरामा अलिकति डर र यो there is a fear के यो किन हुन्छ जस्तो लाग्छ?
So basically हाम्रो नेपालमा पहिला लगेर धेरै अझै पनि ठाउँहरू छन् मान्छेहरूलाई ललाई फकाइ गरेर बाहिर लगेर अङ्ग झिकेर बेच्ने organ trafficking को हाम्रो नेपालमा इट्स अ ह्युज इस्यु फ्रम द टाइम हैन बिङ लाइक 30-40 वर्ष अगाडि पहिल्यैदेखि नै हैन यहाँबाट झिकेर भारतमा लगेर झिकेर अङ्ग बेच्यो भन्ने त्यो कहानीहरू हामी सुन्दै आइरहेको हौं.
त्यो कहानी मलाई पनि याद छ भनेपछि भन्नु न.
एक्ज्याक्टली, र अझै पनि त्यो कहानीहरू हाम्रो समाजमा छन्
केसेसहरू. यस
हैन एक्ज्याक्टली त्यो छन्. लगेर झिकेर अङ्ग झिकेर बेच्दियो, यो मान्छेको अपरेसन गरेर झिक्यो, बेहोस बनाएर छोडिदियो भन्ने कुराहरू अझै पनि हाम्रो समाजमा त्यो कथाहरू छन् हैन. त्यसलाई चिर्नको लागि वी निड बेटर एजुकेसन हैन, र त्यो एजुकेसन चाहिँ हाम्रो हाई स्कुल लेभलको स्टुडेन्टलाई हामीले दिन सक्नु पर्यो. त्यहाँदेखि
यो मेडिकल फेसिलिटीमा या मेडिकली साइन्स पढ्छु भन्नेहरूलाई मात्रै बुझाइ पनि हुन्छ?
नो फर पब्लिक
हजुर.
दे शुड अन्डरस्ट्यान्ड फ्रम द अर्ली स्कुलिङ हैन, हाई स्कुलमा +2 मा कलेजमा, एन्ड देन एटलिस्ट वी शुड फिड देम विथ द नलेज हैन व्हाट इज अर्गन डोनेसन के हो के टाइप्सहरु हुन्छन् मस्तिष्कको मृत्यु सिम्पल कुरा एन्ड व्हेन डज पिपल निड ट्रान्सप्लान्टेसन यो कुराहरु सिम्पल नलेजहरु चाहिँ हामीले हाई स्कुलदेखि नै बच्चाहरुलाई दिनुपर्छ जस्तो लाग्छ मलाई देन ओन्ली वी क्यान मुभ फरवर्ड
एक्ज्याक्टली
they will understand they can go back to their home they can teach their parents their society हैन यही कुरा हामीले चाहिँ होक्से र मण्डन देउपुर हजुरलाई थाहा होला काभ्रेको ठाउँहरु जहाँ चाहिँ इट्स नोटोरियसली नोन फर किडनी भ्याली हैन lot of people were lured for money हैन त्यो पैसाको लोभ देखाएर लगेर किडनी निकाल्ने बेच्ने गाउँहरु छन् अझै पनि हैन few years ago only there was a big racket हैन smuggling organs were caught by police so त्यस्तो गाउँहरुमा पनि हामीले गएर लास्ट इयर 2000 विद्यार्थीलाई हाई स्कुल स्टुडेन्टहरुलाई हामीले वर्कशप गरेको छौं होक्से त्यो पाँच खालको एरिया र मण्डन देउपुर नगरपालिकामा so I think these are the best ways to teach spread knowledge about organ donation. So what we want to lobby with the health ministry, we are planning to go as a delegation with health education minister. And त्यहाँ चाहिँ हामी के गर्न चाहन्छौं भने सानो क्लासदेखि हाई स्कुलदेखि +2 एउटा च्याप्टर चाहिँ कम से कम organ donation र transplantation को बारेमा हुनु पर्यो. So that all our young next generation त्यो knowledge gap नहोस्
fear taboo नहोस्
fear नहोस् knowledge को gap नहोस् so that they can convince their family their society हैन यो कुराहरु गर्नुपर्छ भनेर हामीले लागिराछौं
हजुर र यही प्रयासहरु गरिराख्दाखेरि यो प्रयासमा अब सबै सरकारको साथ नहुन सक्ला तर सरकारको साथ नभएपछि कसको साथ भयो भने चाहिँ यसमा सबैजनाले चाहिँ अर्गन डोनेसनको बारेमा अझै थप चर्चा गर्न सकिन्छ यसको बुझाइ बढाउन सकिन्छ भन्ने चर्चाहरु गर्न बाँकी नै छन् तर यो छोटो ब्रेक पछि कार्यक्रममा फेरि स्वागत छ हाम्रो दर्शकहरुलाई एकदमै विस्तृत र एकदमै गम्भीर विषयमा हामीले चर्चा पनि गरिरहेको छौं र यो सबै कुरा अर्गन डोनेसनको कुरा चाहिँ नेपालको पोलिसी एजुकेसन अवेयरनेस हरेक कुरामा यसलाई चाहिँ जोड दिन सकिन्छ हामी भन्दा मात्रै 10 वर्ष अगाडि नेपाल क्रोएसिया सँगको मात्रै पनि उदाहरण लिन सक्यो भने धेरै चीज इम्प्लिमेन्ट गर्न सक्यो भने नेपालले पनि त्यस्तै खाली चाहिँ अर्गन डोनेसनको माहौल नेपालमा बनाउन सक्छ एन्ड त्यही कन्भर्सेसन गर्नको लागि आज हामीसँग डाक्टर प्रदेश सापकोटा र डाक्टर सिनेमन सुल्लिvan हुनुहुन्छ डाक्टर Cinnamon, I would love to ask you this question. When we talk about educating people, policies, government work, they will be done when it will be done. There are lots of processes. But to do that also, to feel motivated also, there needs to be support for healthcare workers maybe, for having such workers. And Fulbright Foundation has been that leading example that they have been trying to have that access for many people. And that's why Fulbright also makes that standard for many to have their journey or have their career path towards Fulbright as well. So what does exactly Fulbright Foundation is working to work on organ donation or towards health, and how you are ensuring it is being easier for people to understand organ donation, maybe for healthcare workers or anyone?
So the Fulbright Foundation is a national organization in the United States, and the goal of Fulbright Foundation is to promote peace and promote an exchange of information across all countries. And in terms of supporting learning about organ donation, when the Nepal Organ Donation Foundation put together this project, they reached out to the Fulbright Foundation for support. And then they got to see various Fulbright specialists that were listed, and I was very fortunate to be asked to come. The Fulbright Foundation itself not only works with this organization, but they do work in economics, business, science, arts, medicine, all throughout. So actually, if there's any organization in Nepal across any specialty that wants support, they can go to fulbrightnepal.org, and they will be able to put forth their project and look at people that are specialists in that area from the United States and have them come and help.
Yes.
So the Fulbright Foundation is supportive of education across the entire spectrum
And that's why also Fulbright is quite popular here in Nepal as well, because the work and the impact is reaching and winning many hearts of Nepalese as well. And we hope that there is a growth. Dr. Pradez, हामी लगभग कार्यक्रमको अन्त्यमा आइराख्दाखेरि चाहिँ हजुरले चाहिँ अर्गन डोनेसनमा चाहिँ अबको 5 वर्षमा चाहिँ नेपालमा चाहिँ यस्तो खाले चेन्जेस चाहिँ यो फ्रेमवर्कहरु चाहिँ आइहाल्नु पर्छ, यस्तो खाले चाहिँ तपाईले चाहिँ नेपालको अर्गन डोनेसनको फ्युचर देख्नु भएको छ.
थ्यांक यू. र मेरो एउटा मात्र अहिले एकदम मलाई लाग्ने कुरा के हो भन्दाखेरि I'm a liver transplant surgeon. I'm working for Nepal Organ Donation Foundation. I know been doing so many programs. र मलाई के लाग्छ भने अझै पनि हामीसँग केही पनि छैन. म बिरामी भए, if I need kidney transplant, liver transplant, if there is no kin relatives, then I will die. There is no hope. Brain death program is the only hope. नेपालमा तपाईलाई पर्यो, मलाई पर्यो, तपाईको फ्यामिलीलाई पर्यो, कुनै हाम्रो लिडरहरुको फ्यामिली कसैलाई पर्यो भने पनि हामीसँग छैन. There is nothing. So we need to work together. We need our leaders, those people who are leading in health ministry, they should realize it's not only they're not doing for now, they're not doing for anyone. They should be doing, working, thinking.
Yes.
As a leader who are leading health ministry. र यो भएन भने हाम्रो विकल्प केही पनि छैन. हामीसँग केही पनि छैन मर्नु बाहेक. So let's work together. आजैदेखि education, awareness plus पोलिसीमा हामीहरु लबी गरौँ. We went as a delegation. Recent Home Minister कोमा हामी delegation गएको थियौं. We want to lobby. National ID मा हामीले 3-4 पन्नाको राष्ट्रिय परिचय पत्रमा 3-4 पन्नाको फर्म फिल अप गर्छौं. त्यसमा एउटा क्वेशन हुनु पर्यो.
Yes.
Do you want to be an organ donor? Yes, no. त्यो हाम्रो प्लेस चाहिँ राष्ट्रिय परिचय पत्रमा हुनु पर्यो. त्यो हुँदा बित्तिकै there are several ways यो प्रोग्राम अगाडि बढ्छ.
Exactly.
हैन त्यो कुराहरु चाहिँ मलाई भन्न मन लागेको र आउँदो 5 वर्षमा हामीले यही अनुसार काम गर्न सक्यो भने नेपालको पपुलेसन less than 3 crore हो. We can make a really good donation system.
Yes.
हैन वर्ल्डमा नै हामी एक्जाम्पल बन्न सक्छौं. We can do it. हाम्रो नेचर कल्चर त्यस्तो छ दिने donate गर्न. So let's work together.
Yes, definitely we have to work together, and we are almost end of our show. This is my final question to you, Dr. Cinnamon. What makes you feel very hopeful about Nepal's future for organ donation?
I think the thing that makes me the most hopeful are the number of people that came to this conference. The fact that there was a national conference for the first time to talk about it, and to see the passion of the Nepal Organ Donation Foundation, to see all the work that Dr. Pradez and his wife Sneda have put into this. They want it so badly. And the fact that your government back in 2016 already said that they wanted it. So they've said they want it, so they get to put in legislation to support it. We get to have healthcare leaders here that help train their colleagues. I think it's exciting, and I think it can be done as well.
Yes, definitely. And the thing you should take away from this conversation is the world is open for collaboration. Nepal should be open for collaboration, and that is how we are going to have the access towards health, and organ donation should be as it is, and it should be our right as well. And to make that, there are ways of things that you are working on, and we wish you all the best that organ donation becomes as easy, as accessible, and as talked about conversation in every household of Nepal. Thank you so much for joining us here today and giving us your very valuable and insightful conversation on organ donation. Thank you so much.
Thank you so much.
र यही सँगसँगै आज हामी कार्यक्रमको अन्त्यमा आइसकेको छौं, जहाँ अर्गन डोनेसनलाई लिएर हामीले धेरै कुरा छलफल गरिसकेको छौं र यसमा अझै बुझ्नको लागि पनि हजुरले अर्गन डोनेसनको बारेमा गएर नेपालमै भइरहेको कार्य डाक्टर प्रदेश सापकोटा, डाक्टर सिनेमन सुल्लिभनलाई फलो गरेर पनि कार्यहरू बुझ्न पनि सक्नुहुन्छ. र यही भन्दै अब तपाईलाई हामीलाई बिदा दिनु होला. तर आज भइरहेको आईपीएलको म्याचेसहरू हजुरले कान्तिपुर म्याक्स प्रत्यक्ष लाइभ हेरेर पनि हामीलाई साथ दिनु होला. तपाईको दिन शुभ रहोस्. हामीलाई साथ दिदै गर्नु होला, हेर्दै गर्नु होला कान्तिपुर टेलिभिजन. धन्यवाद. नमस्ते.